Hi, everyone. Okay. We're just going to start with just some introductions as we wait for the last couple of folks to trickle in. So, welcome to our session on mastering the art of clinical feedback, when to debrief and when to direct. I'm Rachel Elkin. I'm a peds emergency medicine physician at Columbia.
I can go. I'm Asum Weiss. I'm one of the SIM faculty and general emergency medicine attendings at Columbia.
Hi, I'm Janice. I'm also general EM faculty and simulation faculty. We're all coming from same institution.
Jason Chu, also from Columbia.
I'm Rachel, PGY3 in emergency medicine at Columbia Cornell.
Incoming chief.
Nice. I voted. Dave Kessler, pediatric ER, also at Columbia. We have a small group, so why don't we go around and see where everyone's from and what brought you to this workshop?
Sean McCormick. I'm one of the APDs at Wayne State Detroit Medical Center. And I guess I'm here because residents are always saying that their feedback's too non-specific, and it says, nice job, good work. They don't feel like they're getting anything that actually helps them feel better on their written evaluations.
Hi, everyone. I'm Emily Bartlett. I work at a couple sites, at an academic site in New Mexico, and then also with the Indian Health Service rurally. So work with a diverse group of learners, including off-service residents at the academic shop and different levels of trainees, obviously, and then have a lot of rotating residents from different institutions who come in different backgrounds at a more rural site, and always interested in being able to host those students better.
Welcome, come on in. We're just doing intros.
Hi, I'm Dominic Gregorio. I'm a third-year med student, and here to help if you see my blue jacket anywhere around. But I guess I'm interested in how one day to give feedback, but also, like, for now, how to receive it well and know the difference between what I'm receiving, and maybe also to feel good when I get good feedback and, like, brush it off if I realize I'm getting bad form feedback.
Amazing.
Yeah.
No, we would love your feedback too on the model. And if you're like, nah, I don't like that, give me like an Instagram like instead.
I'm Kirsten Dierks. I'm a third-year medical student at UT Southwestern. I'm also an MSA, so I was assigned to this session, but I'm really, feedback is such a critical part to medical student learning. So very interested in, hearing this discussion.
Amazing.
Hello, my name is Nick DeLuga. I'm a assistant professor at University of Kentucky. Really just here to, I don't work with residents all that much because I work in one of our community affiliated hospitals. So I'm just trying to, be a better preceptor when they are with me on those few days of the week when they're there.
Great. I think you'll find the model can be applied to colleagues, to peers, nurses you work with, etc. It's sort of not meant to be hierarchical per se.
Hi, I'm Jana Anderson. I'm from Mayo Clinic. I'm peds emergency medicine. We work with EM, peds, and family practice residents. We don't have fellows, and I guess surgery residents.
Thank you. Welcome.
Hi, I'm Christine Stamen. I'm at Peoria, University of Illinois College of Medicine, Peoria. Unfortunately, I was late because my food took forever. So I mostly do wellness education for my residents, but I'm also kind of side hat the faculty development. And so anything I can do to help my fellow faculty, especially my non-academic clinical faculty, give better feedback to residents and students. Yeah. It's definitely wellness inspired too.
I'm Megan Reynolds. I am at The Ohio State University and Nationwide Children's Hospital, do EMPEM. So I work with lots of different types of learners as core faculty and one of our med directors too. So lots of APPs.
Great. Welcome. And should we do the song that everyone else did also? No? I'm just kidding. Just introduce yourself and what brought you to this workshop, if you don't mind.
I'm David. I'm an emergency physician and retrieval physician from Australia, Melbourne, and we have a lot of trainees and people under my care that are want to make sure I give the proper feedback to. And
Welcome. It's just so much fantastic and diverse expertise in the room, and we're looking forward to learning from all you guys. I'm going to turn it over to our workshop captain.
We're actually going to start with Rachel.
Captains.
Yeah.
Okay, should we go to the next slide?
Yep.
Okay, so we have no disclosures. Just to kind of set the stage for us, we're going to start off with just some kind of foundational concepts just to kind of make sure we have all a shared mental model around some key ideas and feedback and debriefing. You all will then get a chance to practice applying these in some small group settings. And then we'll have a kind of a large group wrap up at the end. So just before we kick things off, I just wanted to kind of start off with the basic assumption. Some of you may have heard this before, but just we bring this from simulation, which is our background. We believe that everyone participating in this workshop is intelligent, capable, cares about doing their best, and wants to improve. As facilitators, we hold this towards you, the participants, and as participants, we hope you also hold this towards us as the facilitators. Next slide, please. So our objectives for today are to understand key differences between feedback and debriefing, to review when to apply direct feedback versus debriefing techniques in clinical teaching, and to practice using focused facilitation techniques to explore learners' decision-making frameworks. So we'd love to hear from you before we get started. So just some questions to kind of spark some reflection. To think about either a positive or challenging experience you had receiving or giving feedback, and why was it positive or challenging? Or think about a positive or challenging experience you had when debriefing or being debriefed, and why was it positive or challenging? So I'll give you a moment. Feel free to just raise your hand or even just shout out. Feel free to kind of respond to whichever question kind of resonates most with you.
The most challenging experience receiving feedback that I've ever had was as a third-year medical student. I had a attending tell me, most of our med students are little flowers that we have to nurture and help grow. You're too big already. And that was the extent of her feedback for me. She also said, actually, that's not true. She also said, you're not going to be a very good doctor. It's nothing you can do about it. It's just who you are.
Oh, goodness. Okay.
No, I'm not. I'm too big.
That's a way to make someone feel small with, goodness. Okay. All right. Yes. Yes. Well, hopefully we're going to give you some different tools so that if you find yourself in that situation again, you maybe can kind of think about how you might have approached that situation differently. Other experiences or thoughts?
So yeah, our residents are constantly saying that they want specific, actionable, directed feedback. And then we have to balance that with faculty giving us the feedback that when they've given feedback, it's viewed as criticism. And so then if there's almost anything negative, they don't want to put it in writing. They might come to us as the APDs and give us verbal feedback that someone maybe not is doing well, but they will not put it in a written evaluation. And so that's kind of a challenge for us to balance what the residents are getting and then what we're getting. And so, yeah.
I think one challenge I experience is making sure I understand where residents should be at any given time. And it can be challenging even within 1 year, like if residents have been off service and then back in the ER, to know like where should this person be. And again, people come from different institutions. I think I've experienced having one trainee that was actually in fellowship but couldn't complete some basic procedures. And I was like, how do I provide this feedback? Like, this is not going well. And I feel like I don't know how to. The negative feedback can be harder than the positive feedback for sure.
I'll throw a positive one out. We had a resident who recently went through some remediation, and she made a point after listening to us of every shift she'd show up and say, this is what I'm working on today at the beginning of the shift. And then at the end of the shift, we could give her whatever feedback we wanted, but as long as we answered how she did on that day. And that we've tried to take that to everybody. Hey, if you want feedback, giving us this. But yeah, so that makes it a lot easier because I know what they want to focus on, and I can also give them some other stuff too. And it primes me to even think about it because sometimes shifts are so busy that we don't even think about the feedback.
I was just going to say, I feel very heard with your statement because that is our constant challenge too, is making sure that we're developing an environment where people are ready to receive feedback and the people that are providing the feedback are also giving quality feedback, which is also an extreme challenge when, you know, faculty, we have multiple sites. We're spread out all over the place. We have multiple residents. And so, you might get one shift with a patient, or not a patient, but one shift with a learner in 3 months, and like trying to give people quality feedback for like that limited time is really challenging. And so people don't want to put it in writing. And then there's like just this general feel, but nobody knows how to express it. And it's a cluster.
I think for students, like a challenging experience could be where you ask for feedback at the end of a rotation, like you're supposed to, and then you talk to them and they're really nice to your face. And then you get your eval back and they were like, they did fine. And you're just like, oh, like that's not the vibe that you just gave me when you were giving me feedback. But as far as positive experiences, I think anytime there's just like a one-on-one sit down time where it's like meant to be feedback, very obvious for the learner. It's not just like at the end, you know, ERs can be hard because you can't like, let's go to my office. That's not really something. But just like moving away from the group so it's not overheard and giving specific actionable feedback of like, I really liked that you did this. I thought your presentations were really good. I thought this patient encounter was really good. Those have always been times where even if it wasn't the most positive thing, I've left feeling like I grew from that experience versus was just like, cool. So.
Yeah, I agree with what you said. Some of the most challenging experiences with feedback is the lack of it. So anytime that I'm not getting really a strong message either way is like torture, because I'm like the uncertainty is worse than getting abused actually. Um, and then for positive, it's not automatically like, oh, you're doing great. Really, like if I don't get anything constructive, then it doesn't feel that good. But when somebody has I don't know, they're in your corner and they're coaching you to keep getting better and they keep coming back and giving you more, then that's a sign they care and that they're not giving up on you, but that they think you can be great. So all the most positive experiences are like constructive feedback on things to do more of, or add.
Sort of a subtle reflective point. I'm just thinking about a tough case I had once, and we went to debrief, and it was very intellectual, and I felt like I wasn't ready for that conversation yet, and I was still in the processing stage of understanding what happened and like hadn't acknowledged the emotional valence. So that's something I think about now when I have medical students who are seeing some of these emergency situations for the first time.
So I'm hearing a lot of really sort of smart things that are presaging some of the things that we'll talk about today. Kind of that SMART feedback, so specific, measurable, actionable, relevant, and timely, can be more helpful than these sort of vague, non-specific kind of forms of feedback. But also really how the challenges around creating an environment of mutuality and psychological safety where people can feel comfortable giving feedback that may not always be positive, may be more constructive, and where a learner feels sort of ready to receive that and kind of a way that supports growth. So thank you all for sharing your experiences. Next slide, please. Okay. So just before we get into more of the nuts and bolts around feedback and debriefing, we wanted to sort of share this conceptual organization of different approaches to feedback and debriefing or ways to interact with learners This is something we're still working on, so would certainly love if you have any feedback on how to make this clearer or kind of more accessible. But in thinking about what strategies you might want to use in a given encounter with the learner, there's a couple of different dimensions that you might consider. And the first is your goal as an instructor or facilitator. And so whether your goal is giving feedback or your goal is uncovering frames. And just so we're all on the same page, frames are known by many different names, things like frames of reference, mental models, schemata. These are the things that are in our learners' heads and are driving their actions and behaviors. So if you are looking to give, and the second dimension is kind of the presence or absence of reflection or learner input. So if you're looking to give feedback and are inviting some bidirectionality or learner input, that falls into the zone of reflective feedback. If you are looking to give feedback but in a more unidirectional way without significant learner input, that is more in the area of directive feedback. Conversely, if you're looking to uncover frames, and with sort of learner input, this falls into debriefing, and we'll talk about some techniques there. And then if you have sort of just ideas in your head of what's going on but are not really testing them against the learner, those are just the assumptions that you hold. I think this is actually an old slide, but so pardon us for that. As you might expect, the ones that do invite learner input are ones that are going to take more time and so tend to be a little bit of a longer conversation. But that said, they don't need to be very long and these can still happen within the span of a few minutes. So it can be certainly doable on shift in real time. Reflective feedback and just moving forward so we're all on the same page, we're gonna be talking today about kind of real-time feedback and formative feedback rather than kind of the written summative feedback.
Make it here. So I think that's what there's. No, we're just troubleshooting. Go on.
Oh, okay. All right. So yeah. So the ones on kind of the top half or in the top two quadrants are ones that are going to take longer, as I was sort of mentioning, and tend to be more kind of after action settings. Whereas directive feedback tends to be much shorter and tends to be kind of real time or just after a clinical event. Next slide.
Yeah, I think this works as a mic as well. So we're just going to step back a little bit and then just discuss kind of some basic definitions. So feedback in clinical teaching is any communication that gives some information or gives someone information about their behavior for the purposes of influencing that person's current and or future performance. Obviously, the point of it is to provide constructive and timely feedback because we think that can improve our learners' clinical skills and decision making processes. So why is this important, right? Our goal is improved behavior. Improved behavior is going to lead to improved clinical skills. Ultimately, all this is going to lead to improved patient safety and quality of our care that we give to our patients. Sounds like most of us work in some level of academic centers. Providing feedback is also going to help promote kind of the educational mission that we have in a lot of our academic sites. So some barriers to feedback. These were supposed to show up one by one, and I was going to ask you all if you guys wanted to share some barriers to feedback. So I guess since they're up there already, I think a big one is timing, and we kind of alluded to that, and also maybe kind of like timing and space, right? We might be spread out amongst different clinical sites, don't see the same resident multiple times, so it's hard to build that rapport. And then also you're like, I just had a busy shift, I kind of just want to go home. But it's important. It doesn't take long to provide either feedback or to debrief them, and the more you do it, the more you focus on it, you might build that rapport, and then each time you provide feedback might be shorter and shorter, right? So it's kind of like when you have a difficult patient encounter. When I remember when I was in OSCEs, they would always teach us spend a few minutes up front with the patient, so that way you go back and answer less questions down the line. Same thing kind of with our learners, like spend the time up front, build a rapport, and then debriefing and providing feedback kind of gets easier. Another big thing is, again, because you're not there all the time and with the same residents or learners, you might feel uncomfortable with potentially uncomfortable conversations, right? So it's not always, hey, you did a great job today. Sometimes there's things that need to be improved, and you have to like approach those topics. Not knowing how to provide feedback effectively. Hopefully we walk away after the session feeling a little bit more comfortable. And a big thing is the learner has to be receptive, right? Like the learner needs to be able to obtain that feedback and want the feedback. And you want to build a culture of feedback and psychological safety. Again, it's a culture, so it's not something that we're going to change overnight. But hopefully, over doing this multiple times, your learners learn to trust you, and it makes it easier. So some of you guys have alluded to like what is not good feedback. Again, this was supposed to show up one by one. You guys kind of mentioned, you were saying that, just not, hey, you did a good job. Like that's nice. It's nice to hear, get to go home, say, hey, I did a good job, but what did I do nicely? Like it's nice to also know that. So just complimenting without reinforcing specific behaviors, not great feedback. Being critical, being better, you're too big, you're not going to turn into a flower. Like that's not going to be helpful feedback either. So you want constructive guidance. You want to just say that was completely wrong. And some key points to remember are when you're giving feedback, especially clinical feedback, you want to focus on the performance and not the performer. So you want to really focus on the things that they did, the actions, behaviors. Feedback should be smart. Some of you guys have alluded to that as well. And we're going to go through something called the ask, tell, ask model and go more into how smart feedback fits into that model. So in this slide, this is kind of just the framework that we're working off of today. We're going to focus for the next few minutes on reflective and directive feedback. And really in the yellow lower, what is that, lower left corner, it should be assumptions. Is that right? Oh, right for you guys, left for me. Sorry. So what are the differences between directive and reflective? Right. So directive feedback is you're giving very specific suggestions or instructions. It doesn't take into account the reasons for the learner's actions, and because of its unilateral direction, it's a unilateral discussion. Versus reflective is going to be open-ended. You're promoting self-reflection. So this is a more of a bi-directional conversation that you're really able to explore explore the reasons for the learner's performance. So a quick example of directive feedback. So you're supervising a resident placing a central line, right? So what you see is that first image, you have your IJ over your carotid artery, right? So this is something you want to fix in the moment, right? You're not going to wait for them to start the procedure. You're going to say, hey, let's hold on. You notice how, so one way you can approach it is you can just say fan down, right? And just give kind of a direction to them or instruction to them. Or you can expand a little bit more and say, hey, you notice how the vein is right over the artery? That increases your risk of accidentally backwalling and puncturing the artery. I like to have the vessels next to each other. Let's fan down and see what we see, right? And then you'll end up in that second image. And then you'll have the resident place the central line. So you're still providing instruction, you're still directing them, but just in a little different tone.
So next, I'm going to go over reflective feedback. You notice that with the directive, there's no reflection on the part of the learner. You just say, do X, and rather than, oh, why are you doing this? For reflective, we're conceptualizing a feedback sandwich, and I think I went used to the other sandwich, where it's like compliment, criticism, compliment, right? And then when you start off, they hear the first compliment, they cringe because they know something else is following. And here we're there are different models, and what the model that we're proposing is the ask, tell, ask model. Next slide. So the first ask, then we're focusing on behaviors, and we're asking the learner something about to ask them to think about and reflect on what just happened and what they just did. And so it's like, what are things that they did well, or they feel comfortable with, or things they felt challenging, maybe what they want to work on, and then what they want to, how they want to improve. And then next slide. The tell is when we are, or these is a smart paradigm. Sometimes you will see it in QI, where it's like, then we're saying something we want to be specific and giving examples, want to be some measurable objectives. Something that's actionable, something that they can modify in terms of the behavior, and then it has to be relevant. It has to be a gap that we observed, and then it should be timely, right? We want to do this fairly proximal to the event, rather than something then at the end of the shift or the 5 days later, right? And then the ask part at the action plan is then after asking the random for reflection and then coming up with the tell our observations, then we'll say, well, now we'll come up with the action plan as to how to then modify their behavior, right? Say we'll develop we'll ask the learner to come to think about how they might modify their behavior, and then we'll come up with our plan to modify the behavior. We'll model this stuff in the next couple of slides. Okay. Okay. Doesn't matter.
All right.
Okay, so Janice, hey, so the setting is it was a difficult intubation. It was a difficult intubation. Janice actually had to try a couple of times to intubate this person. All right, so that's the setting. Okay, so Janice, hey, so that was a fairly difficult intubation. You eventually got it. Tell me about how you thought it went.
I mean, I really thought I would get it a lot sooner. It just took longer than I thought. I tried to just keep looking at the vocal cord. I just couldn't see. I would just feel like I was just right there. I just didn't realize how much time it passed.
Yes. One thing I noticed when you were doing it, that you looked like it was you were fairly deep, and so when you're so deep, we had a difficult time seeing the vocal cords, and when you tried to pass the tube that first time, it didn't really work. And then when you readjust it, and then I saw you pull back, and then you decide, oh, maybe we'll try some Craig pressure, some extralaryngeal maneuvers, and that actually brought the vocal cords into view, and then you were able to pass the tube at that point. I guess moving forward, like, what do you think? How do you think you might do this differently the next time?
I mean, based on the feedback you gave me, maybe next time if I'm not able to visualize vocal cord right away, I can back up first and think of applying correct pressure early on.
I think that's a great plan. I think we'll just keep that in mind for the future, right? And so this is our example of a critiquing behavior. Someone who didn't do that well, and instead of saying, "Oh, that was terrible. You're never going to grow," or just, but a different way of going about it, right?
I just want to highlight something here too, because I don't know if you guys picked this up, but for me, everything you said to her came from such a place of caring. I think, as you pointed out, that that was really the underlying ether of everything that made it work as well. So it's not just this model of ask, tell, ask, but that you could tell that he really cared about her improvement, and I think that's the secret sauce.
Also, you guys mentioned about learner being ready to be there to receive feedback is also important. Maybe I'm already like, man, that like went so bad. I'm like, maybe I'm just like, hitting myself in the head, and my mind is just not in the right place to have the feedback. So giving the learner and kind of checking at the beginning, hey, how are you feeling? Do you want to vent a bit? What do you want to talk about? That will be good. Ooh, like, oh yeah, I think I went great, pretty good. I got eventually. Oh, that's good. We can actually try.
Oh, it actually went the way it started out. It was kind of like that, because the way Janice was playing, it's like, oh, I had a little difficult, but then eventually got it. So I think so in their mind, it's like, oh, I got the tube, so it was fine. So that's that was, and then when my observation was, well, you got the tube, but this is these are some of the problems I saw, and just I guess grounding them or bringing them to your viewpoint.
Yeah, the beauty of this model with that ask is, as you could check in with where they're at, right? So imagine the resident or the student said, blames everyone else, right? Like, I was having trouble because that nurse didn't do this or that RT didn't do this. So Jason would shift. He's not going to then give feedback of, maybe about the deaf, but he might sort of pursue that further. What was it about that? And it might be the action plan is like, how can you, if you, when you're feeling like people aren't helping you, what can you do for that, right? And then maybe later he's like, by the way, you were too deep, like, but maybe what the feedback is about how that person adjusts when they're struggling. So that's where the ask really comes. You have to be ready and flexible to change the feedback that you thought they needed to something that they actually need in that moment.
Also, sorry.
I guess just a question. So in this particular example, the learner sort of identified maybe the thing that needed to change. I could imagine a scenario where maybe they identified one thing, but you also want them to think about the fact that we need to oxygenate and ventilate, and they shouldn't spend 5 minutes just trying to get a tube in, and that we have to have this like broader picture. And so I could imagine also needing to pivot and be directive in addition to the ask, tell, ask framework. And so maybe combining things. Curious if that's something you are addressing.
I don't think they're mutually exclusive, and you can certainly combine some of these techniques. And that's where I think developing sort of an arsenal or toolbox as an educator, and you can mix and match and find language that feels and combinations that feel authentic to you. But I would also add that in both the tell of the ask, tell, ask, and in some of the focus facilitation models, which we'll talk about in debriefing, a key part of that is using sort of your expert judgment or opinion as the supervisor or educator. And so that's your opportunity to sort of make some of those things clear to the learner. You're doing it from a place of positive regard and mutuality and believing that the learner is genuinely trying their best and coming from a good place. So you can find ways to incorporate them even in these more reflective models as well.
So I think one of my biggest challenges is tell me. But so I think one of the biggest challenges is, or one of the easiest things in emergency medicine is to give targeted feedback based on a case or a procedure. But when you're getting to more of that summative feedback, especially if you're trying to gear towards things like milestones for our learners, like that's where it feels falling apart. So I don't know if there's how you do that specific and measurable and timely and stuff when it's more summative.
It's an excellent point, and clearly today we're not focusing on how to write up summative feedback. It's more of a formative thing, but I think the two are together because a lot of people mentioned like I worked with someone once, and then like I had this summative thing, and like if you've given them smart feedback on that shift, and I started taking notes. Okay, I talked to them about the intubation. I talked about this. Then calling that up doesn't feel like a gotcha later. You're like, yeah, on a shift we had this specific thing that happened, and we talked about this, and assuming that feedback was received, right? It should be familiar to them later when they read it. And actually, I forgot how many PDs were in the room, but our PD is always like, please just give me these specific things. So I'm not just saying, versions of good adjectives or bad adjectives. And they're piecing together everyone's feedback. So I don't know if that helps answer the question, but I feel like you could anchor on the 2 or 3. I mean, look, you only worked with them twice. You're not going to talk about globally where they are and maybe your NA for a lot of those milestones, but the procedure one you gave feedback about. I don't know if other people.
Are you talking about these year-end summative meetings?
Like, I think a lot of times the learners approach their request for feedback in a more summative request.
Oh, the end of shit.
Yeah. Rather than can you give me feedback on that case, right? Like they're like, well, how did I do? And you're like, great.
So their one option too is to ask the last time. How do you, right? You sort of, how do you think you did? What are the things you were struggling with? And develop the bigger plan as opposed to being about a specific moment. It could be about shift performance.
Also, I think it depends on the learner level to the intern versus senior. We do have the prevent shift where the senior residents are doing a technique shift. In those shifts, I try to focus on some of the specification care, but also kind of overall how you're doing in the technique where that some of the piece can come. I feel like maybe senior residents might be asking for that, so you kind of give. I think that's at least how I did it globally as a leadership, and then monitoring the room wise how do you do. But otherwise, other kind of feedbacks are mostly directed, like kind of case focused, so that they do feel like it's a constructive feedback that they can relate with the patient care and possibly modify or continue doing good behavior.
I think someone also asked or mentioned that there was one learner, and they're trying to sort of generalize this, that they would sort of say what they were working on at the beginning of the shift. You could also ask, like, what do you want feedback on? Do you want on a particular case we saw together, or more on the shift as a whole, and set expectations together to make sure that sort of they're ready to receive the kind of feedback that you're going to.
So now it wants to do the step by step.
Okay, next slide. Okay. So we're in play scenario of also intubation, but this time it was the setting is someone who came in with angioedema and required a fairly urgent emergent airway, and went well, right? And so an easy thing to do would be say, oh, that was great, you did a great job, right? Or the SLS model is like, hey, that was a really difficult intubation, and tell me how you think it went.
I think it went over pretty well. Angioedema wasn't as bad as I thought, and I feel like I had all my equipment that I needed with me.
Yeah, when I saw the patient and I saw the amount of swelling, that was really concerning. But when I also saw your preparation and you saw you had multiple backups available with 2 different ET tube sizes, a bougie, a cry kit even, and then when we saw the vocal cords and how swollen it was, you said, oh, you automatically went for the smaller tube and passed it and did well. I guess that's my question for you is like, moving forward, how do you think you can bring this forward to your future intubations?
I mean, I thought I was well prepared. I realized I didn't have all the equipment handy next to me. So I think that's what I can even make it better next time I have angioedema patients.
Yeah, I think that sounds great. I think you did a great job, and that sounds like a great plan. All right.
Thank you.
Shift to speaking about debriefing now.
Okay. All right. So in our revised figure, just replace that yellow square with assumptions. All right, because and right now we're going to go to that top green square, and we're going to talk about the concept of debriefing and how that might differ somewhat, but overlap a little bit with our ask tell ask. The main thing on our model is that when you're debriefing someone, you're going to allow for reflection from the learner, but your goal is to sort of understand why they did something. Sometimes we talk about it as uncovering frames of or scripts that people have in their head for sort of their performance or behavior. Next slide. So one of the definitions of debriefing in clinical teaching is that it's a reflective discussion aimed at exploring the thought process behind a learner's actions and decisions. And not just are you trying to explore it, but you're also sometimes the learner themselves hasn't thought about why they do something or where they learned something or how they picked up a behavior. So again, there's concepts of adult behavior change, and this is partly why I did peds, because I don't want to convince people to stop smoking or vaping unless they're kids. And but we get frozen in our way. You ever drive to work and not even think about how you got there, right? You just like sort of, these scripts help us get through life, but it also means it's really hard to change behaviors and habits that we have formed. So you have to do something called unfreezing, and that usually takes a paradigm shift. Like all of a sudden I'm driving to work and someone tells me, oh, I always take Broadway instead of Main, and you're like, wait, what? Like, and like my world is rocked, and now I want to try to learn that new route. Okay. So the other reason, okay, no, I covered that. Next slide. So just like we talked about Jason's like really nice regard for the learner earlier, I think some of the prerequisites for debriefing are, this is not a conversation you're going to have when someone is stealing opioids from the Omnicell, doing, that's a different conversation, right? So to debrief, you need to genuinely be curious first of why they did something. This is one of the hardest things to practice, because also as adults, we have a lot of biases, a lot of assumptions about people. We're very judgmental, and those things are implicit and automatic often. So when you practice curiosity, often through debriefing, you start to really sort of keep an open mind about, well, what are the other reasons why they might have done this, right? So why did that resident go too deep? Is it a knowledge gap? Is it that the attending in the last shift told them to do that? Is it that they couldn't see at all what they were doing because they are actually in between glasses prescriptions? Like, who knows, right? So you play in your mind, like we're all going to have some assumption, but you try to find some genuine curiosity. That's a prerequisite. Second is the positive regard for learner that we talked about. And finally, psychological safety. So what matters, and I think again this is something that you astutely mentioned, is that the same sentence, the same feedback from someone who is someone that you feel like really respects you and you respect them is going to land very differently than when it's from your mortal enemy or someone else. If your best friend says, "Hey, you got broccoli in your teeth," you're like, "Oh my god, thank you so much." When it's someone you don't get along with, you're like, "Oh, that person's so catty and I can't believe it," right? So psychological safety, we're not going to get into all the aspects of it today, but as a concept, you need to make sure that you've created that environment where people feel safe with your feedback. um, Okay, so we're going to talk about focused facilitation. There's many terms to this. If you've done, how many people have done simulation before or done debriefing courses before? And so you might have heard advocacy inquiry or focused facilitation model. And so what we've done just sort of to teach this with is create this framework called the triple O. It's fun to remember because ozone clears the air. So if you want to clear the air and have a debriefing conversation, and all you got to remember is these three O's, right? So does the next slide go through it? If so, we'll flip over there. Yes, there we are. So the first thing is you have to observe a fact. This is also where it gets fun, where you start to question the things you thought were facts, right? Because sometimes we have assumptions about what a fact was. But you're going to sort of notice something that happened, and this is the thing you're hopefully curious about. Why did that behavior happen? This is important to then give your opinion in the middle, right? So sometimes we think our opinions are facts. They're not, right? Just because AHA said the CPR rate should be this and this, I don't know, maybe they just updated it last month and you didn't take that course, right? So this puts skin in the game. So rather than being hierarchical, where like I'm the attending, I'm smarter than you, I know everything, it's sort of like, this is the way I like to do it, and this is why. And then finally, your open-ended question is key, because if you ask a yes/no question, you're going to get a yes or a no. This does not open up frames. This does not allow for reflection, and then for that unfreezing of behavior that can happen before you refreeze. So the other challenge of this, so as you start to practice it, is making all those things connect to each other. So sometimes when I teach people to debrief, they're going through the O's, and they're sort of like, one's a fact, and then the opinion's about something different, and then the question has nothing to do with that, right? So obviously, the goal is to get these all to connect together. Next slide. So an example might be a 23-year-old male presents with a stab wound to the lower ribs. You wanted the resident to assess the airway, breathing, and circulation first, but they grabbed the probe for the ultrasound because they just had their ultrasound rotation, and they went to do the fast. So how might you debrief about this? Does anyone want to give that a try? Just go through the triple O. Australia, Melbourne. Okay. You could just do one. You could even start with one of them.
I noticed that you went to do the EFAST first up. I think that in these cases it would be more beneficial usually to start with a full ABC before we get to the EFAST. So I was curious to see what your thought process was as to why you went for the EFAST first.
Beautiful job. Excellent. So, yes. Well, that's a yes, no. To an open-ended, you're almost. I said that was a yes/no question, but if you end with an open-ended, you're there. So two things about the comment. One is that what's key in debriefing is find your authentic voice. When I first learned it, there was like one place teaching like the advocacy inquiry framework, and this guy Dan Raymer just would always start every set. He would be like, "I noticed this," and so everyone around debriefing would always say, "I noticed this. I noticed this." You don't have to say, "I noticed this," right? Find your voice, speak in your voice. If it's snarky, that's fine. What people care about is, do you care about them, right? So the Blackstone Group is a business entity that does radical candor, right? And it's basically like being clear is kind, right? Again, you want someone to tell you there's broccoli in your teeth. If you don't know what's going on, that's death as a med student. You want the feedback so you can improve, right? But you want it from someone who actually cares about your improvement, and you know that. I'm pretty snarky on a shift, but I think that if I'm not paying attention to you, I think that's probably worse. Yep. You're gonna test to my snarkiness, or
No. I actually, I want to say that, like, as someone who's getting feedback a lot, there's almost something I like about it because it almost feels antagonistic. People are like, "So what comes first?" And then you're like going through ABCs, and then you're like, "Okay, I'm an idiot. I get it. I'm so dumb." So sometimes just like saying it and then being like, "Oh, right." I don't know.
Right.
I think it was actually helpful. I don't think it was just snarky.
yeah. What happened there? You got the ultrasound probe before your ABCs. Last I checked, you do ABCs. What's going on? If you know I care about you, then it's fine. Uh-huh. Mm-hmm. Uh-huh. Yeah.
And so I'm like, hey, F fast. We learned ABC first, right?
Uh-huh.
I feel like that would definitely be more viable.
And so my only question to you, right, in that is that like clarifying whether you're giving a didactic, right, where you're sort of like refreshing them on the letters, right, or whether you're really curious what happened in that person's mind now, where you're trying to uncover a frame. Because again, there's no reason to debrief it if you're not curious about like why, like I just taught them this, like why are they forgetting it, like what's going on, and maybe they're like, I'm so sorry, I know you taught it, but I was distracted because my grandma, died the other day. You're like, oh God, not saying you always need to open up those frames, but people always have them, and in the right scenario, opening them up helps you as a educator sort of know what's going on with them. All right, next. Yep. Oh, sorry. Good.
I tend to use both approaches, but I find the snarky approach I would use with a resident that I've known for a while. I need to figure out known for a while. I need to figure out where they are with the humor first, because some of them might not take that approach as polite, or they might get offended and blah, 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 blah. So using the other technique that you just introduced is actually, I think, quite good personally, because I think that's easier for someone I don't know, or is just doing a shift, or is just for some reason I haven't met in the 3 months.
There might be a whole other workshop here on comedy and feedback, but one of the reasons we like comedy, right, is because they give you that paradigm shift, right? They start with a story and you think it's going one way, and then you get surprised by the hook or the joke, right? And that wakes us up and we all laugh, right? And I think it's okay to use humor. It could be risky, right, with someone you don't know, but as long as it's your authentic voice, I think that works. Again, focus on the O3. The open-ended question is where it's at, because you're curious about why they're doing something, and you also want to promote their reflection. That's the ultimate point of the debriefing. Next slide.
We went through this already.
Okay, next. All right. Yep, sure.
So do you find that by starting with your observation first, you actually get a better reflection in the open-ended question?
As opposed to leaving your observation out, do you mean? Or
Yeah, or like where
or
you're
the
just
order
like,
of it.
oh, so how do you think that code went?
Right. This is one of the differences. It's interesting because we struggled a lot with like ask, tell, ask has components that, again, there's a Venn diagram here that overlaps, or there's this grid, and part of it, yeah. So it's very interesting, some of the overlaps between them. I find a couple things. First of all, triple O is your framework, is your starting point. People debrief sometimes, they do it in different orders. Again, you can play around with this. There's nothing set in stone. It's just the concept behind it. But I'll just reiterate some of the importance of each thing. One is that you have to be talking about the same thing. So the observation of fact, wherever it happens, has to be something you observe about. Sometimes at the observation of fact, especially if people try to guess at your frame, is where you already have to start over. You're like, I noticed you were too deep, and they're like, I wasn't too deep, and you're like, oh, we have different facts here, right? So it's interesting, right? So sometimes then you just have to stop there. The opinion, it gets really hard to do this because the way we learn to educate usually is, in this more didactic way, where sort of it's either the royal we do this, and this is the way we do things, or I do, saying I really is like vulnerable. It's like, I do this, I choose this tube size, not this is the right tube size, right? But what that signals to the learner is that you're willing to have a conversation about it. So it's no longer a guess what I'm thinking kind of question, like you alluded to, like, also like, when you sort of are like, you mentioned that too, right? Like when someone's just like, so how'd it go? You're like, what is it you're going to say, right? It's in essence that first part of that feedback sandwich. And finally, that open-ended question, This is also where we sort of, if you're not genuinely curious at that stage, people see right through that, right? Okay, like what are you getting at? What's the hidden message? Triple O and the idea of especially that opinion is to get rid of the hidden message. I'm telling you right up front, right? The Socratic method has its value, and there's a lot of literature about letting people come up with their own ideas without you telling them, right? That's where ask, tell, ask comes in. You know, what were you thinking? Before I give you any answers, like what do you think the right steps were in that procedure, right? And I'm going to fill it in after, but I want to see what you thought, because by reconstructing it, it's like building a differential diagnosis on your own. I don't give it to you, right? But this is different than that. This is like you want to eliminate that social anxiety by saying, I think you did good, or I think you did better, and this is how. But what was going on for you, you know? So it takes away that anxiety. Does that make sense? Ready for cartoons? Yeah, okay, Masoom, take it away.
Yeah, so we're gonna watch a about 2-minute clip on Monsters Inc. I want you guys to pay attention to the learner in the situation, and then also like how they get feedback or debriefing, and we'll talk about it. Hopefully this works. I don't know how to turn the volume up.
Simulation terminated. Simulation terminated. Simulation terminated. Simulation terminated. Simulation terminated.
All right, Mr. Bile, is it?
My friends call me Flem.
Uh-huh. Mr. Bile, can you tell me what you did wrong?
I fell down.
No, before that. Can anyone tell me Mr. Bile's big mistake? Anyone? Ugh. Let's take a look at the tape. Here we go. Right. There. See? The door. You left it wide open. And leaving the door open is the worst mistake any employee can make because...
It could let in a draft.
It could let in a child.
All right, I hope, were you guys able to hear that? Okay, great. All right, so what are your thoughts about that type of feedback or debriefing? What's that?
I noticed.
You noticed? Yeah, so they use part of the language. Any other thoughts?
Didn't seem like the educator was genuinely interested in hearing the responses or teaching them.
Okay. Yeah, so a little bit like very judgmental feel of the feedback or debriefing that was going on, right? So like very much so like I have the answers, right? What is the worst thing that a monster can do? Like language like that we want to avoid. How would you guys have gone differently about giving feedback or debriefing this case? Yeah, so I noticed.
One fundamental thing too, right? We never got what's his name, Flem?
Phlegm, yeah.
Framework perspective. You know nothing about why he got the door.
Yeah. So if we had, given, if we debriefed with I noticed, I think that I'm curious. Like, do you guys want to model that language to how you might approach Phlegm, the monster? Nobody? No?
Or we can even just start with the first part, like the first observation. Does anyone want to try? We can do it together.
Yeah. So she says she noticed what was the major bad thing that happened. Like, what did she notice? Yeah. So you can say, I noticed that the door was left open. I think that leaving the door open is bad because you can let in a child, right? So then you can ask, what was like, why was the door open? Like, what was going through your mind when you left the door open? Can you guys think of, I know it's a little hard to hear, but like, what might be a reasonable thing that Phlegm might say? Like, there's a range of things you can say. I was scared. right? So it might show some vulnerability. So if Flem were to say, I'm scared, you might think that this is a beginner level person that needs to build their confidence, and you can kind of steer the conversation in that direction. What other reasons could somebody have to screw up that way? Maybe they forgot and were like, I didn't know it was important. Yeah.
I was so busy.
Right. So maybe you've identified a gap that now you can provide to him so that he knows that I need to pay attention to this. I think one thing to recognize is like this type of, the way that they did it in this situation, like Flem's gonna know, like I always need to keep the door closed, right? So even with that judgmental kind of debriefing model, you're still getting that point across. It's just how motivated is Flem going to be to come to your next simulation session or work on shift with you the next time? Yeah.
I, Flem, was so busy running through my mind my plan for scaring the child, I didn't even think about the door.
Yeah.
There was no thought regarding the door whatsoever.
Yeah. I know the volume's a little bit low, but I'm going to replay just the beginning portion of it. And so do you guys notice when the door's opening, there's a creak and the child wakes up, right? So what if Flem's framework is, I didn't want to close the door because it makes a creak, and if I close the door, my scare is ruined, right? So now you're thinking Flem is not this beginner that doesn't know. He's somebody more advanced that's thinking steps ahead. So he did forget a critical action, but for the right reasons, right? So then it changes your opinion of Flem from being like, oh, that kid doesn't know anything, like he's a lost cause, or like, how do you make it through medical school or through Monsters University and not know to close the door, right? So it kind of changes your, yeah, it changes your opinion of Flem as a learner, right? Any other thoughts are about that? Yeah.
I think that clip's really funny too because you have the other learners,
Mhm.
quote unquote, where they're equally as perplexed about the goal. Which brings, was it you that said it before? Like a lot of times your learners have no idea where they're supposed to be, or you don't know where they're supposed to be. Like it
just varies so much
right
depending on the shift.
Right, exactly. And I think that just brings out a really kind of challenge right now. But like knowing what you're measuring or ruling them against.
Mm-hmm. Yeah. So I love that clip because it kind of gives you an idea of like, you have to kind of know where your learner's coming from sometimes and meet them in the middle.
Also context here, like it was very clearly publicly given critique and feedback.
Right.
Maybe not the safest in terms of psychological safety.
And I'm thinking this is a rounding. I don't know round shift as a kind of format. This is almost meaning this format of performance as a part of rounding rather than learning opportunity. And then
I think for positive regard, like it was obviously all the tone and everything was there, but the even just the fact that they asked to confirm his name and he said, you know, you call me Flem, and they kind of refused and went over that request.
Yeah.
Not the most positive or not the greatest sign of a positive regard.
There's a great paper, I'm blanking on her name, the giving feedback with good judgment, which I think has a great framework of comparing like judgmental versus non-judgmental ways of giving feedback. And what we strive for is like giving feedback with good judgment. Like you want there to be judgment. You don't want the learner to be guessing what's good or bad about what they did, but the way you provide it has to be in a good way so that they can walk away in positive spirits, even if it's something that's constructive or something that they can improve on. So to motivate them to want to come back and work with you. Cool. All right, next we're gonna break out into small groups. There's more learners than anticipated. What? 5 in each group? Okay. So we'll break out into 2 small groups. So there'll be 5 participants per group. We have Juliet and Rachel who are our volunteers who are gonna act as our learners in these cases. And then you guys will have an opportunity to either provide feedback using directive feedback, reflective, the ask, tell, ask model, or or debriefing them based on your own judgment. You can try multiple approaches for the same case. And then some of us will act as facilitators and will debrief your debriefing or debrief your feedback after each case. 450? Yeah. Yeah. So we'll do that for about 45 minutes. So we have 10 minutes to kind of wrap up at the end. All right. So to make the groups, maybe we'll. Yeah, we'll count off just so it can break up. So you'll start.
1, 2, 1, 2, 1, 2.
Perfect. All right. Yeah, perfect. You guys are what? These are cases.
One. We have several different case stems, and we can kind of also sort of feel free to draw and we can try different variations. In the past, we've had people kind of create a sort of talk about but anyone be a different one or all right, so you can read the stem and then you can choose if you'd like to write go backwards.
So this is
No, you can just tell us.
Alright, so the first case is a resident. A resident presents to listen to your email that has mentioned history of retirement status, depending on nursing, mover, and state. Patient is not on the party, but normal sensitive. Resident has particularly answered possibly without the different class or has to them. Or you would get attention or concern that this plan and services is on 1 minute.
So what? So one thing I realized when I highlight during the discussion, this is where right? So you do all that. So now we know the phrase covered the deal with phrase.
extend capital. Whether you're doing the triple E, whether it's you can start, you can go around and start at the same pace. Just go around and start. Try to figure out how start here.
So I'm curious to figure out exactly which you're thinking or just maybe. I saw that what were the steps in the supposedly will be hard and you yeah. My opinion is the steps is right here. Probably have to walk over and see as well.
What's amazing, I'm thinking about you in your role and just using that as a question of your resident, your attending to understand what they did, right? While also you're telegraphing what we know already, you know, and it really worked that way. And again, this is not a hierarchical kind of conversation, right? It's just a way to understand.
I think in general, I find especially
That's what's so key. That's what's so key about like the opinion part, right? Like imagine walking into the conversation, right, where I'm giving you feedback and I'm acting like there's only, you know, like you should have definitely done this, like you're messing up our metrics. And you're like, hold on, you know?
Not because he's trying to.
yeah. So yeah, so I think it's not something like
Yeah, I guess I think we all know you have acceptance. Emails that has problems, a little bit more triggering, but I think, and in this kind of case, the point of it is our go about understanding our career, but now that we know that the conversation always comes in and has the so this is right. Now we'll see. Now we progressive. The next time is like, okay, what is different about this case? Why is this different than our other cases? Now you have the chance to go back. Let's look at your part. What is different? It's conscious about how we think what this is something yet. It's instead of just not a simple UTI. We're going to set just the fire change out.
And then I actually
Think about it. To give the next page here. From here, how did you learn? How did that feel?
Yeah, I mean, I think it was really important because he works there, and I have my own word like that. Because the thing is, they're all out here, so I was it's not about my fact that she's reality screwing and she does. I hear she will be on me and I was and I didn't pay attention.
So the facts here that you picked up on was really critical to that conversation.
Just a couple things that sort of stood out. But you actually sort of flip it on like it's great and fine. You can certainly feel great. So when you actually kind of stated your initial observation, her brain actually came up right away. It was great. And then you sort of know where she's coming from. You then kind of went into her opinion, and you actually said, I think that's fine, which I don't think was actually really thought that there was a problem, and then we're going to comment and re-regulate the broader kind of stuff. So we're actually just kind of mindful about being clear about what we're doing. I think where we often get different information, like we're very Catholic, that was fine, so just being sort of mindful of that. And then your open question was, what are your next steps? Which certainly not really talked about. But one of the things that we were we try and do is try to make sure we make a lot of the questions related to so if you have to be curious what you guys answer, you can start and get the question.
Well, that maybe is framework, yeah. So there was like a certain job station king to round train is just straight behind us. It's like water and turn machine. So now I'm just working on the mental and we read for this all the time. They
Sure, yeah. What I love about that, first two things. First of all, I don't know if others noticed that the three O's weren't necessarily in order, right? And it doesn't matter, right? It was very authentic. It came off natural. It was sort of like and then you know, and it worked really well. It's also the frame that was uncovered, and then like in my mind, until I heard that frame, I was going at a different direction. Like, oh, it's a knowledge thing or whatever. And once you kind of get your recency bias, you brought this very great point of advocacy in your position. So it totally pivots the conversation. You know, so much of behavior change, right? Has to do with that underlying frame. And we tend to assume it's knowledge, where usually that's not. It's no water. The risk there, right, you can imagine if you just told her in a directed way, like, we don't do that, we're for that too much. Even if you did it nicely, she just, I don't know if she's gonna change her behavior based on it. Okay, I'm gonna learn that kind of doesn't like me to do it. You know what I mean? But I'm gonna do it because I'm still scared. You know, right? Yeah.
It seems like they learn your therapy and you're like, instead of like, because if people will say like you're gonna learn the way you kind of work when I'm obviously engineers, we're like, oh, what is that? Right? So I want to help you. I kind of say at the beginning, like, hey, I'm really here.
And another framework potentially for this could be, let's say he is now senior resident, she's been practicing the last year. Right? So she's going to be more independent, doesn't have supervision. That's going to change how she practices. Because the debriefing could be very similar.
Yeah.
Assess like the risk benefit of the work that you're doing. But again, an important note, to demonstrate that knowing where the learner is.
So even we have like on the framework for the first time,
Right.
like one time right to live like they do and I guess people should even though living comes up like I'm well and actually people this on the record so like one fine, under great, good, well, okay. Fair enough, I guess that was not everyone. Be great. We can feel free to read and go around and down. Try to do it. Where's it more than she said it's wrong? There's less like
That's the humility. You know, and having skin in the game and leveling, allowing for the possibility that you also might be missing information. Probably one of the common ones, right? Like residents will come out, like the parents ask for something like on pediatrics. So you're sitting there thinking like, why are you doing all this? And they're like, I wouldn't have done this, but like they asked for this and they have a note from the urologist, and you're like, that's different. Okay, it's not your knowledge gap. Maybe we could.
When the experts are like, oh, that's a great change. I just figured things between
Sorry, just a disclaimer, I guess what the case is, it's something can be pretty, depending on like, emails we get or like from an environment that we live in. The point of it is really like the feedback and debriefing portion. Some people might work up 35-year-old or not. That's your second position. The point is just go by the script, that's how what you're feeling is what the script is. With a P and then I observed that these applications, we were missing the rest of the history, which was nice. Because just wanted to see we had an observation, we had your opinion, and we had an open question. One thing that they were really knowing when I was really difficult space. One is because it's so common to want to say something nice at the beginning, which may or may not understand. My question about it, right? And so my question about it was that genuine or not? Was genuine, like I believe that you genuinely enjoy these facts, right? But if it was sort of like giving you a sugar sandwich, you know, where the middle is sort of like some stuff, you gotta figure it out. If it was like soft and difficult feedback, sometimes again that can be like more satisfying, right? But actually, you're told. I didn't hear that thing. So I was going to ask you what you said. The other thing was in the open-ended question was asking about how she felt, which is funny. I'm just wondering if that was what you really wanted to know, was how she feels about it, or something else, because you didn't feel as connected to the observation of what happened. You didn't observe. You seemed frazzled and blah blah blah. So how did you feel? That's what I meant before about connecting. So I know it's very yeah. Because really, like when I sometimes like I'm sensing it in judgment, right? You're like afraid to ask the real thing, which is like why didn't you do this? What was legally said before? And so I use that in my saying that the last thing I should be doing. So either that like that was next, you didn't tell me that's what it did. I thought if we wanted the focus on maybe and the important thing is, even though we're getting a whole technical from the adaptive standpoint to try to learn about different things, the kindness is there, positive regard. Juliet's reaction was, I think this is great, and she just like, it was very difficult feedback to receive, right? So I think that's sort of nice to in your own voice. And that's also we talk about what like this factors. So they don't be able to kind of feedback. But it does. But that's why I feel like I think bringing up feedback just finding things also didn't look more. We are. But there's always we have all the things. Why you took away everyone to. It's everything in mind, and we are just like
teaching something is what the cause. You can't take money from it, you can between them. So all year when you're with your students, you're afraid of there's the word things that whether it's illegal taxes or something, they actually and then when it's that day, you're like, this is what happened today, you're running into yours, people are saying theirs. So I feel like you don't have to be like that, otherwise always go back and tell these things.
Well, don't want to point. I think there's a couple things from the positive psychology literature we know that at least a 2-to-1, if not 5-to-1, some studies ratio of that we should be doing positive and negative sort of feedback and conversation. Right. But the other thing I wanted to sort of like emphasize is positive is not just like we talked about. It should also be specific. It's not just about saying good job to make you feel good. I like you. It's also to build resiliency over the things you're doing well. You took. I can tell you. It's like I'm measuring like that was a great first presentation. I can tell you took a great history. For the rest of the shift, I want you to do it in 10 seconds because like I don't know you're on that. But like I do want to reinforce that they did a good job with something. And that's a little bit of speaker talking about just reinforcing the behavior. And I guess in that case I'm saying don't do it. But
I was gonna say
so that was a bad example, but the point is positive feedback also just sort of like and very specific. Right now.
I was just the okay, that's great.
There weren't always matches though that food history. I noticed you told me in the past few sheets this question.
We do monthly, I think so, we were getting a lot of from. I kind of thought it was on the whole spiral exam, and so we actually have a grab code that has some questions. What went well today, what could have better, and any other things that don't speak too much. So have it up in history with because it is the first question. It's really concerned because he's unvaccinated.
It's true, I feel like that is and like feel like you're about to give me like your feedback, you're there. I'm just hoping that you personally appeal. And we just
like family or planning or like all in their agile and what they want to explore from the fine, like their birthday. So it's kind of like that's kind of how I think about it as well. Like, I want to be there for the good and the bad. So it also we often say like, this needs to be better. But like for most of those things that there's not kind of
There's a whole.
Thank you.
Last little part. Let's see. I'm expecting them to shift as the children
So, one thing is that just for us,
I
relationships and so yeah, they might be
part of history. They should use their shift that I use on all the immunizations and person identity tests. Always review them. But I think I'm curious what you well, right. Well, personally, it's always hard for me to give feedback to people. I always feel
PA presents a patient neutrality after being diagnosed.
I don't want to criticize.
PA resources patients.
But if I just focus on the subject matter and
But you have a patient in patient's therapy, actual letter instruction can be shown rather than simple results.
that always helps.
I think that.
Drastically harder.
Yeah, it's not really hard. Can you want to
So trying to separate from my sister and we're not trying to like personality traits or things that
to address the
Just one thought was your open-ended question that was kind of what were the other things that go for it. So, which did like kind of
So I know that really frustrating the student not respect that thing to their ER.
so kind of thinking about and
I definitely have some that, back all the time and wish that, I could have asked her how, how you got her reason. Would you be willing to explain your student a little bit more about why you focused specifically on just thinking she's being seeking rather than something else in mind?
so that gets into a little bit more of the teaching.
Trying to figure out what and like how to work about.
Yeah, it was true. The thing that told her and a resident don't ask for her works on this, she went to why am I so hard, like so nice people, and they all feel like she's like all the time, so more of like writing people actions.
Is there anything really better in history that made you really think that the status is always something you versus going on or well, did you have much questions? Yeah, wasn't but I was jumping towards education versus being the all do that in the share. Being the all is very business and who was like I was listening to you. Still changed or that action that maybe is almost reactive. So try thinking about what I'm curious about, what we want to say about I would like, oh, maybe what can we say about or is it very sincere? I would do the whole thing. I have so thought, yeah, sorry, about like probably one curious question. Yeah, like being touchy. I don't walk to work every single because I'm thinking about like I would right. So I think if I made a mistake like that, I would actually feel more urgent, right? I would be, worth your luck by the way, because she's like gas. No, I totally read like a lot we were all and I would be not a flinch. And I really looking back on something that I want to go look at professors of programs and things that I don't even know.
So the area that
literally the whole back chair. And you can kind of see how I struggle about the curiosity question is the people always not always. It doesn't mean that anyway, but I want to do ground check. It's like, these are 40 years time, and if you go on this, I just want to be home. You with me, she's sitting in my chair because she's still Roberto and comes there all the time. And so again, when you're really curious about something, I simply don't get or I can show you some yes, I know it's not. The ones are like the dead country that was word. I think it was vibes with them. I was not.
So we walk away together.
If you set forward and they perfectly need like no action to change your own side. Do you have like experience with respiration on back? I think that maybe you can know what it's not what I said struggle. I'm not.
I'm gonna break it down and see. Yeah, you give us some of your reactions.
And give feedback. Then that's really
Feedback.
There's no one great answer, so I think, you get to that.
Yeah,
I feel like you're working really hard to not hear what we're not there, or it's a little bit, so it's different, but take care of it, you want to be sure.
and then you have like, somebody who's like,
And we were trying to think about it, people of like, George, maybe then, and a little bit of the like, I noticed like, oh, this was really,
but trying to like really help frustrated what we have to really
yeah,
get there and not just
I feel that.
because I know that it's really smart to just so really much prepared like I just be able to do that and I'm so worried about this just walking there and making their
She started out with like an empathy kind of statement for your plan. I thought that was so interesting. And well, you were frustrated, so she read you really well. Right? Like bring you back. Right.
My resident
oh my god, I was like, what is this? So
didn't hear as much of an opinion as much as sort of saying. I also feel like if I was like, I feel frustrated too. Like it's not like I'm up here better than you. Like I'm with you. Like, we're both frustrated. So that was really interesting. It's like more of a high advanced level, right? Because it's like first of all you're taking a risk of feeling, which could backfire. When you get it right, right? If you're working in space, and your opinion essentially was sharing the feeling, and now let's just go straight to understanding like how you made that decision.
Sharing feelings. I have had instances where that has been a positive on it. Yeah. For me, it's so independent. I think I work notion of environments that I know which ones I can work with. Just like they kind of go together. I mean, I tend to shy away from it too much, but my residents, I tend to like I know which ones I can do with and which ones I can follow. Should. All right. So I just saw that patient things that just mean so.
Depending on
let's talk a little bit more about
there's a difference between when you're assessing a performer versus a performance. So, typical cases where you're judgments are kind of personality versus
and I was just wondering if you could tell me where you were going around.
I noticed it could be like a procedure or like the way you present to the patient is different than continuously observing them speak negatively to console. So there's a little difference between like when you're assessing a performer versus like a performer.
It's as long as you frame it as it's still a performance, right? Every single
thing. Yeah,
actually, so why we were third. That hey, you know, I have noticed every time I found you still have that and I think that's also really frustrating to deal with. But unfortunately, this is causing more frustration because they're reacting to how you're actually not there, but you're still assessing the performance, right? We're not judging them. I feel like a lot of people
That was a great example of like and a very complex thing to observe that complex kind of emotion, right? That experience, you observe that, you have an opinion about how that's impacting things that are important to them, right? And then if it was a question of knowing their brain, that's where you can define how you're like, how you're experiencing it, you know, and maybe that's where they start to think, well, this is why I do it. And it opens up to now wanting to change.
That's what was good. It wasn't at all. I probably not the performance. Because I had what I said. I tried to find and I was thinking about after that little boy had to be Bill, we're going to really struggle with addiction now because I think it's about and we were talking to me like what's your thoughts?
I think it's very like partner. I know I will be much more.
And so it was like not judging, like no judgment of me.
So I think that was part of it. Just I'm a little bit more dark.
We're not addressing the question. It's complex, because you're talking not just about emotions, but when you share, when you vulnerable.
And what level of it you share. And some of that is especially what we're talking about. So here's kind of we're not, and then you get to say about hey, you just see what it's like what we deal with down here, so you don't judge me from upstairs, right? So this is super frustrating, and you're gonna be frustrated. So I was going to because we are trying to keep people to hear that, right? So I think again, there's frame of that. It's a little bit discussion. I don't know. I actually kind of just sometimes I'm going to realize what I didn't see last night. That's the one thing. Like I come out, we're gonna try and I don't know that, but like we'll be right back. I'm very excited to be able to shift. I'm sorry.
I forget who it was. I was just like I worked with someone during a month and on a day shift and they were like, I didn't know you were tall because I've only worked nights with you. And I'm like, yeah, I don't think I speak at night. You know.
It's my 6th grade. I'm like just crying. if you can just wait until. Give me all your.
Yeah, the
Motion for the.
Right.
It's kind of.
Yes. Right. If you're not in a place to receive it. The other thing that makes me think of when you were speaking about your regular residents is like it's also like a matter of if you zoom out to like what is our curriculum, what is our goal, like is everyone supposed to get feedback on X, Y, or Z? So like there's like high level debriefing you're doing with your residents where like you gotta understand some of these like lifelong, resilient, living burnout, wellness, like emotional regulation stuff. That's not quite in the curriculum milestone right now. That's sort of, so then that's, if that's part of your sort of agenda, then you're gonna wanna put it next. Well, that's right.
Like, you know what I mean? Like, it's always a hard reading the you know what I mean? No.
How do you just add a different how do you sort of get that exposure?
And I think that's very perfect, right? You're talking about judging the performance and then you're building the performance.
Yeah, this one is, we can do the first thing and then turn. Oh, yeah, sorry.
Yeah, because to really focus on. I really remember appreciating going to the whole week times that I did making sure everything, feeling feels nothing is being done, but patients are positive for residents, especially if he respond and really raise for that candidate, the critical step works at. The resident would be like security gain to explain.
So same scenario, you notice the resident, the family member is yelling the whole way, there escalates it. And long story, I haven't been sent home. Okay. And now, so now you want to reinforce it.
She did it by sitting down and making eye
No, I think the resident was concerned, I just want to staff, change the location. It's hard to know what you guys go through, but just over a little bit.
Well, it's just, yeah, it's the same. Same, just making it out.
But it's still a behavior or that was created a choice that being driven by the brain. That then drives their judgments or decision or action. And so some of these techniques are also identified that brain that will help to or that they can use in our team. If maybe a little if they don't, that they don't like at least yeah, honestly, I was looking for they would still be the three times consequences introduced and there are other things that and something that can draw their belief that we're all working so we're perfect. But like we're kind of and so we try to be different. What was going on the most what we might have to do other than help someone in a situation that's very
I'm curious, April Garner was a little bit like, well, everyone says it.
sometimes no, I didn't bother if you want or any other guys.
Definitely all, I think it's all lines there, so just to put a fine point in from a third party account standpoint.
I hear you, but
That's, it's interesting, in the opinion, I'm curious
it's
about
been a
how
long
it's
time.
instead of talking about it being important, which is one way, certainly my opinion, right? If we talked about how you felt that impacted the situation, and if that would make any difference at all in terms of then, how you're asking.
I would definitely say.
None are right or wrong, and just like curious, like how that impacts us.
It's more of me spot.
Right. I mean, it was interesting.
Like you said, there was on the most personal sort of level of you help them as it was like you made it better. So I think that like that part of it was more of the than what is important.
And then I saw the house.
So whether positive or negative, I think that important is sort of more general than like high level, like we all value this. Actually, for that, and I think you really more important so that it's more notable.
It's spoken, I find it difficult because it's a culture and it's a departmental culture.
And no, that's the case. For me personally, when I was first learning about speech fellowship, I kept it very simple. Like, I would always do it in order. We always say, I need to listen to my thing, like, I'm serious. And we do it every single time. I took no long time to get comfortable enough with the language where I had to kind of switch from one to the other. But my default is always, I know this typing.
He's good to mix it up on you.
Yeah. It's not bad. But like for me, personally, like I take kind of the way I my conversation, like outside of work sometimes as well. And it helps like conversation like every default person.
The first one was so
That's
something else. I'm sort of like, so what the news did she like that? She's like, different hours. I'm like, but let's keep it out in this aspect. She's like, I'll go change it. It's already done. That's fine. I got shut. But don't do that again. And we don't do that about so that because you understand you went home for standing up. So I know what we're going to talk about. So we knew you would do that something. You would come home, fix it, whatever they were done. The other one was a bit hard, and you didn't think it was a big deal. So I take a little bit of time to explain from it and make it and see that when I use it, in a Google.
Do you use a lot of like
Seconds. I heard it. That's the other thing. I find the behaviors would be again, improvements. Remember how we even asked how often? Even though I talked about that? Oh, yeah, like that. People don't get much. So,
And I think the reason I started out with more specific is that I found it was very where it's like overtime and time to work something over specific of help.
No.
So that it's not running quickly. So we all start. We know our labor. Why would you be better next time?
Because they're acknowledging that we were managed and that's how it's on our side. We are starting to improve that because we all know the effect of marketing. I don't know.
It's done well, not where it's done at all. Now where it's more like, yeah, the conversation feels like it's integrating. Like, hey, your talk, their presentation to the body, like, how they need to struggle with that. A lot better, I think that, you know,
I don't know, this doesn't make it really useful, okay? And it's not even keep. Yeah.
Oh, okay.
It's sort of what we do.
They don't walk away with it. Yeah, you walk away from it.
So I guess the observer, that was down the channel.
Question. I want to make sure we only have a few minutes left that we get everyone to chance. I can tell them, there's so many times we all for so much out of this we did. And if I ask my resident, hey, let's do one feedback. I'll let you do what happens to them. Like, how does it go? They're giving me 15 things that they did and not like make that. So if I force them to kick off, at least we can address it in their mind. Because they may have shut a lot. It's also one reason why I prefer if I'm talking with a resident and I start similar. What do you want? What particular? Then I'll do it. I usually start over today. Yeah, it's all fun and talk about it throughout the shift as well. I got really good there.
What's the route? What's the
Yeah, I got to start there.
another resident.
You know, we're thinking about the
Really full of
about
information.
this.
And of course, I sort of knew she was, but didn't really, and then of course, as I'm trying to walk out, there are so many people that are like, you might walk for now, and your job is to tell them that you're at the beginning of the shift, so they're prepared, and then they fill it out. Honestly, it's really embarrassing.
But, you know, the conversation you guys are having is here.
I worked out okay.
We struck with this model.
I'm such a good
We're trying to simplify it. Ask to ask is a lot more like you're talking about where you're trying to, how did it go? Like, you know, trying to understand how they think things went before presenting their feedback. Whereas reading the debriefing side of things, to understand why they're doing certain actions or behavior. But you know, we try to divide this in different ways. Like, one's more about the connection and one's about the whole shit. And it's not. You can use either for
identify it really
we talk about debriefing
that's
about
why I-
feelings, you know, and emotions in general. You know, so I think there's a lot of overlap between the
I
two.
thought the setup was fine, I just.
I start more with the feedback side of it now. I'm more of a debriefer trained person, but I think we mostly practice the triple O. And so it's like,
Yeah, there's like, sorry.
no, I'm biased that way. That's why we need to. It's felt like it's like I think that was like a simulation background, from an education background, and we talked to her and years ago. We used to do a workshop dissing the feedback sandwich, and then since that time, the community has updated it to this add to last, which looks a lot like there's a lot of overlap. So we tried to create this workshop to try to challenge yourself and understand the positives of both and where you might use them differently. So we're still working on it. We feedback.
Like I feel a lot of feeling a question away from you.
From that first, like one step.
Is that the last what that is?
We made a couple of guys.
I just feel like it's something that asked me. Like, how did it go today? That's a tough question. Because I was just like, I really, that's a read your mind question. Yeah, it's a read your mind question. It's read your mind. Or even what to do close. Because it makes me get feedback myself. Can't wait. Giving me feedback, that's in feedback. That's feedback I got is something I didn't notice myself. Why do I want to give you myself? I'm right. But we actually, I will say yes and. And the reason I'll say yes and is because there's so much to learn. And then you think you're doing stuff well and you're actually sucking at it. And so I need to know what you think went well or what went bad so that I can say. The other day, he's all starting to pull up the volume. I was like, sorry. No, I thought there was something. There were players different. Yeah, investigators really fun by the next day. And you also took 7 years to dispel everybody. And so it's well harder to sleep into patients. It would be 4 hours to dispel one floor. You got problems. So if you're like, yeah, so my run is right to but also lets me know that you noticed, right? You said, I did really well on this. Or like, actually, you did really well on this, this, and this. Or if you only do beat yourself up and feedback, I think it gives me an opportunity to remind you that you feeling down and you caught something that I really missed. I really like the way so using that gives me a perspective and you have to start reflecting. And then that's relatively for a long later. I went out there and that's what we want to change our areas and talk about challenging the leading. But then I really liked that as long as we're training. There's one and the next frame. I think the only thing I would add at the end is just I couldn't find the kind of like
And so the sort of meta skill in some of this is developing
Yeah, there you go. Maybe I thought. I don't know. I want to say that I felt very genuine. Actually, we cared about her.
I think you were talking back to what you said about and what you're doing as well. Like you're asking not in vacuum, you're asking and understanding the goals that you set at the beginning of the shift and the things you're working on over time. And that doesn't make a difference. And I think, you know, we didn't have a lot of cases like that. Like I think the more common time where I might use an ask, more of a debriefer is like very specific. That came out of a procedure. That feels more like specific. It's like how does that help you go, right? Like that way you buy situation at all get a sense of where they feel like it went well. Or like
Procedures, running code, all that other stuff.
so like shift might be
like when I first had this situation, I was in the rest like is not an issue you would in like third year practicing writing codes for the first time and that costs and I'm like, oh, I noticed this like invasions and I sometimes you think behind it. Or like, you know, myself, it's like the most annoying thing. You're like, all right, we just think I'm just well, think about taking your ball right now. So I think also be timing for this function to be like walk me through what you're used to this, like you already have something well, let's take a step right to Chicago. I think you're
I didn't say, are you ready for this? You know, do whatever. Now,
Yeah, I have like the smart. Like you're technically asking like how did it go, but like you're missing that smart part because you want it to be specific, you want it to be timely.
Well, but that's also a learner responsibility on you. That's kind of like, I did yeah, and if you have good attendance, you can run the code, right? Is there any kids go take a walk to the back?
Yeah, that.
So that was talking, right? Like, otherwise, we've got all talking to our next class and this and candor, but also feedback. All of our residents. About how to accept feedback. Sometimes not too recently thought that that's a local conversation. It could always about checking and stuff like that. And then next time, hey, just want to checking in. I mean, you guys overwhelmed, so that sure that I'm visible to you. I do that with never talking a chance. It's not like that's if I really well for like a long time, and then I'll and then I come back and do another session because you know it's hard. Right? Yeah, that's just about us.
And I wonder if you know, Stan, and I wonder if something that's critical.
Or if you that would
And that's where it's sort of like there's something meta here about the culture. Going back to you know, it's critical, and no one of us alone can do it, whether you're a PD or not, right? But I think it's like there's very little positive reinforcement for the person who gives the feedback. You know, to keep doing it, especially when not all the feedback that you give will make people like you, right? And so that's so anyway, that for me, I still there fun and like that feels good when I have a conversation and I see the next one, like see it and learn and I'm offended and I'm offended to the next one. That feels very good. That feels great. It's not a plan, yeah, and then you have the situations and it's not as good, you're like, why am I doing this?
My last thought, like I love having them here. At work, it just reminds me of my data perspective, and I always try to like hold on to like who I was as a medical student, part of it at least, so that I can recognize it for your needs, because it's different than a resident here, and it's different than your role as a so it's always so I'm here like you like what do you guys do? So I think as you like learn this, you think like back in my day, you have a different perception of like what we were as a graduate student or as an introvert. I feel like it's like we put it in the
We give them more instruction and see.
There's no. Oh yes.
And see how like more or less a lot of work that
I noticed. Yeah, we'll just come back. Yeah. Yeah, we did too. I don't know why it was like the current spots. Or okay. Yeah. I don't know.
No,
No. Yeah, I think I was going to share it on my phone, but I can't get it on the big screen. All right. Okay. All right. I think we could spend a lot of time talking more about debriefing and feedback, and I love the conversations that we've kind of started here, and I hope you guys are able to take some of what we talked about today to your institutions and like carry it on in your professional workspace. I think we went a little bit over time. We're at 5 o'clock now. If people can just share like one thing that they learned or appreciated from today, and we'll go around and then we'll end the session.
Anyone want to start?
I think just getting more comfortable with the crosstalk and asking them what their frame is kind of the newer thing of what they were thinking is what I took.
I like the ozone technique, so I think I can use that like in real life, and I think I'm curious as to why it's like a good kind of non-threatening way to kind of get to where people are thinking.
You guys mentioned all my points.
I think having a tool that's adaptable for both reinforcing and then potentially like providing corrective feedback is really nice.
I think it was just great to have an opportunity to practice using the techniques and try to like implementing your own voice. And even though most of us probably use like the exact same, but trying to like tweak it a little bit so that it actually feels like a little bit more natural to us.
I like that we talk about using it in both positive and negative situations.
I like seeing how everybody else does it, because we can have I can do an ozone and you can do an ozone and you can do an ozone, and we all do it different ways.
I'm gonna add curious into all my questions now.
I appreciated the challenge of having to implement this on the fly and like getting to try to choose between the different forms or modes of providing feedback or debriefing. And I also like that we could practice positive and negative.
Anyone else have any final reflections? Okay.
All right, thank you all. Unfortunately, the slides that we have here weren't updated. We have a QR code on that laptop there. If you guys can just scan it, and then it's for giving us feedback so that we can continue to improve our workshop as well.